gonna come at the end because y'all gonna be so happy when I'm done. All right, so I'm Frankie Wolf, and I'm one of 3 infection control nurses at UAMS. I'm not here under my official, hey Archie, I'm not here under my official as a UAMS employee. I'm doing this independently, and so I have to state that. But there are a couple things. First of all, y'all know Dennis, and y'all know Courtney and Shannon, Archie. I kind of have some favoritism in some folks in the room, so I need everybody to be as educated as you can be on 2 points. One, Ebola is real in the world. It's not, there's not an outbreak in the United States. We've had some emails come out from some epidemiologists and that are actually false information where they're saying that we've had an outbreak. We've not had an outbreak. We've not had any confirmed cases in Arkansas. Now, Shannon said that we would be, UAMS would be the place where patients would go. That's location dependent. If you have a patient who has to stop and, you know, here, let me back up. So let's talk specifically about Ebola and what it is and what you would see. First thing that you're going to do if you approach someone and they're having bloody stools, they're pooping blood, they're throwing up blood, and they tell you that they just come in from Africa. Run away from them. Tell them, I will pray for you, brother. And
You are not right.
I'm just saying. Now, seriously, the first thing you're going to do is you want to find out their travel history. Where have they been? Have they been to, there are only 3 places of concern right now, and that's Liberia, Guinea, and Sierra Leone. It's epidemic proportions there. Have we had patients in the United States come from those areas? Yes, we have. So as one of the things that has to happen is once you find out where they've been, you have to drill down on their contacts. We had one gentleman who had come through Nigeria at the point when he came through had recently been cleared, so it wasn't an issue. But the people at the local hospital.
Well, that scared me.
It's okay.
Okay.
Feedback on a mic.
It's okay,
So,
Secret feedback.
am I talking too loud?
She-
I did too. I thought I was taking a stand with me. Boy, I've lost my place in my brain. He had, thank you. But they were so concerned because he had been from Africa. So I ended up in the emergency room waiting on the patient to come in at 1 o'clock in the morning because they insisted on transferring him. The patient was telling them he had, and here's the type patient that you may see in Poland, Arkansas. The patient had been on an oil rig, had gone down to work on an oil rig. His only contact was from the oil rig in a taxi to the airport. He had not had any contact with anyone who had known Ebola or had even suspect Ebola. So there was really no big concern with him. The other thing is this gentleman had only been there a short period of time. It's one of those where you go work on an oil rig for a week and then you come back. Well, he hadn't even had enough time for exposure to have developed symptoms and such as that. So, we can roll with that PowerPoint. Things that you're most likely to see are the fever, and the fever is going to hit 102, 103, fatigue, vomiting, diarrhea, and loss of appetite. When someone has Ebola, if they're to the point that they're having diarrhea, they're going to be having 5 to 10 liters of either vomit and stool or just stool, 5 to 10 liters. That's what makes them so critical, because they're losing all of their electrolytes. It's not that this virus is hard to kill on surfaces. It's not like it doesn't live for a long period of time. We have some organisms out in the world that live on surfaces for 30 days. This one, you can kill it easily with bleach. It's very, very fragile and can be terminated easily. Just with literally, they're walking over and they're dipping their foot in the bleach, and it kills any contact that they may have had on their feet. Pregnant people are at a 98% mortality. A lot of question comes in, what about if someone comes in and they're pregnant? First of all, I don't know any of our women in central Arkansas that have been to West Africa, but if they have been, one of the things that's happening with the Arkansas Department of Health is travel tracking. Anyone who gets on an airplane from anywhere in Africa that it has a destination point in the United States, they're automatically flagged for travel history and points of contact. We have weekly teleconferences with the CDC and the Arkansas Department of Health. I have their numbers on speed dial on my phone, as do probably most every other infection control nurse in the United States. We have some specifics that we have. These are algorithms, and these are really good tools to have. CDC has put out algorithms that actually break down and identify if the patient has fever with a positive travel history, then it takes you to the next point, from point A to point B. If it's a no, then you go to your next set of questions, and then you're looking at any contacts. I've had people say, well, you know, you can't believe someone when they're stating their travel history. Look at Mr. Duncan. If anyone is in the United States and they have a concern that they were exposed to Ebola, even if by some remote chance that they told a story to get on the plane to get to the United States, okay, they're not going to lie to you right now. Because right now, if they're to the point that they're calling and needing first responders, they're scared. And they're going to tell you the truth right up front. The issue with Mr. Duncan, fully aside, people as a rule do not lie about it because they want the treatment. We also have an algorithm for the emergency department on triage when they come in. We have an algorithm for patients coming in through the ambulatory care settings. Let's flip the slide and let's see what else we have up there. The timeline of infection is within a few days after the symptoms begin. Those patients, as soon as they start running a fever, they're contagious. Until they start running a fever, they're not contagious. So we have had people here in Arkansas that were identified by the Arkansas Department of Health that came in, had been doing missionary work, had come through countries of suspicion, and had been on home monitoring. Does the Arkansas Department of Health make it public? No, because they will be ostracized, the children will be ostracized, but they're strictly monitored, and by that monitoring, the Arkansas Department of Health is going and literally observing the thermometer with the monitoring of the temperature. It's not relying on, my temperature was 98.2, they have to visualize the thermometer. And they even have means, if it's in a remote area, that they could set up Wi-Fi to where that person could have a laptop and they would have to show on Skype or different, whatever other type of methods there are for FaceTime or whatever that stuff is called. So it's really being watched very well. Let's see, that's talking about the IgM and IgG antibodies. Y'all don't really care about that. Let's roll on the next one. Yeah, let's roll on to the next one. This one's probably not. This is more hospital-oriented. Recommendations of care. The primary one is the volume replenishment because they're expelling so much fluid. I talked to Connie Bryant, who is one of the infection control nurses at Emory, and she said they literally had to put pads all the way around the bed because the amount of body fluid that was expelled was so voluminous that it was literally rolling out onto the floors. So fluid replenishment, giving them electrolytes, that's one. Let me back this up too. When someone, the healthcare workers that were exposed here in the United States, one of the reasons that they have had such a high survival rate is immediate identification by self-monitoring. Even the two missionary workers, Dr. Brantley and the other lady, and I apologize, her name's not popping into my head, but I loved her story. They were self-monitoring, and it's that self-monitoring that gets the immediate start of the IV fluids as soon as the temperature spikes before the gross vomiting and diarrhea starts. What else about Ebola? What you need to know is hand hygiene is the most important thing that you can do. If you have someone who is vomiting and throwing up and running a fever, it doesn't matter whether it's Ebola or a stomach virus or whatever, there are still precautions that you're going to take to protect yourself. I'm a firm believer there's nothing on the job worth taking home to the family. And we surely don't want to take something home that's going to hurt somebody. I'm that way about the flu. And in the United States, keep in mind, we're going to have more people die from influenza than anybody ever thought about with Ebola. I saw, of course, I'm a geek when it comes to watching these shows, so I DVR all these shows. And it had this one woman on there said, I can't believe America is just freaking out so bad about Ebola, and you've had a grand total of 5 cases, and my mother is afraid to leave her house in Liberia. And so it really put it in perspective that, you know, in the grand scheme of things, right now it's not a concern. There are some epidemiologists who are saying that it can become a concern. You know, anything can become a concern. But we're a little better able to handle medical situations here in the United States than they are in West Africa. It's just fact on fact. When you perform hand hygiene, alcohol gel as well as soap and water will kill the virus. Your clothes, if you were to have someone expel body fluid on you, wash your clothes in a 10% dilution of bleach. 10% is all it takes. 1 cup of bleach to 9 cups of water, and you're golden. I understand the types of personal protection that you guys actually have are masks and gloves, that you don't have any gowns.
Some departments may have gowns.
Does anybody have any plastic gowns? What about any of the thick plastic suits that you wear? All right, I'll recommend that everybody should have 1 set of plastic gowns for any emergency response that you go to. And the reason that I make that recommendation, it's called standard precautions. Standard precautions means you treat everything as if it's infectious. If you go somewhere and, Tatum, you're cracking me up. If you go somewhere on emergency response and the person is bleeding in a car wreck, you need to protect yourself from that blood. I've been hunting, and so I don't do lotion when I hunt. So my fingers are really dry and cracking. Well, dry, cracked skin opens the doorway for pathogens to get in your body. It doesn't matter whether we're talking about Ebola or whether we're talking about hepatitis, any of it. So I'm going to show you how to put on personal protective equipment. I'm going to show you what we do at UAMS. We actually have two things that we're doing at UAMS. We're doing full hooded PAPRs, which are the purified air hoods. Now what we have are reusable because they are restricted on the number of disposable PAPR hoods that they're sending out, because everybody all of a sudden wanted the PAPR hoods. We had already, 10 days before CDC released the new standards, we had already implemented full body protection, and we have advanced training. We have the Office of Emergency Preparedness, the OEM Office of Emergency Management. Terry Henson came out and did training sessions with us, and we had trained super users, and we have a whole unit that we are remodeling that's going to be strictly for any highly infectious diseases. No place can house more than 2 patients by staffing. You have to have ICU nurses to take care of these patients. So the way we're getting it set up right now, they would go into ICU and we would lock down half of the ICU. That's 8 intensive care beds, and we're the only level 1 trauma center in the state of Arkansas. So what that's doing is locking out 8 beds. We've got this other unit that will get done, and it should be done in 4 weeks. Is Ebola going to be gone in 4 weeks? No. Is Ebola going to be gone in 3 months? No. It's still going to be in West Africa. And the longer it's there, the greater the chance that it can come to the United States. That's the reality of it. So we have to be prepared. UAMS is not the only hospital that's getting prepared. Every other hospital, including Saline, is getting prepared and doing education with staff on how to properly don and doff PPE. PPE is personal protective equipment. To put it on is called donning. To take it off is doffing. So anything that I leave or email to Shannon to kind of distribute out, if you see donning and doffing, that's what it is. It's taking it off or putting it on, taking it off. Any suspect patient, and it would be they call it a PUI, patient under investigation, who has a positive travel history, or who says that they had a family member come from West Africa that had been exposed to someone who had Ebola, is considered a person under investigation. We've had, and actually just this week we have someone coming in who, and I'm learning towns. There's this little town called Cameroon that, no, excuse me, it's not a town. Cameroon is in between the Democratic Republic of Congo and Nigeria. And so I get a call saying, what do we need to do with this person? Well, there's no Ebola there, so we don't really need to do anything. But everybody is so concerned about it. But it's kind of interesting that everybody is on such high alert about it. Everybody wants to put everything on on immediately to protect themselves before they know what's going on. Until you have a positive travel history or know that they have been in direct contact with someone who has had Ebola, then you don't have to have the full personal protective equipment. Does anybody have a question about, and let me ask, have you watched any of the shows about Ebola? The burial rites, do y'all know what the problem is there?
Oh, yeah, I heard about that, because it's their custom to wait for Jesus for the burial.
It's their custom to, everyone comes by and touches the body, and they kiss the body before the body is put to rest, or the person is put to rest. So that's one of the biggest problems that's happening in West Africa, because all the symptoms mimic malaria. And one of the persons that we had that was a patient under investigation, he had malaria. Another one had just recovered from malaria. So the symptoms really do mimic to a certain point. It's that vomiting and diarrhea that gets explosive and expansive, along with the positive travel history and contact. So I'm going to show you how to put on personal protective equipment, which is I'm going to put on what we would wear, short of the Tyvek suit. We have a full hooded Tyvek suit that comes all the way to the thumb. We have booties in our Tyvek suits. We have the PVC step-in boots. So once we come out of our personal protective equipment, we're able to fully remove everything that may have had any exposure. These are the plastic isolation gowns. Gloves. For what you would be doing in the field, it is not required that you have an N95 mask. An N95 mask is the big, thick cone thing. N95 means that it is removing 95% of the particulates from the air before you inhale it. Ebola is not airborne. The only reason that there are going to be people using this type of mask is because of the potential if the patient had to be intubated, or if the patient had to be any type of breathing apparatus put in, BiPAP machine, whatever, that could cause it to aerosolize. That is not going to happen on your watch. And if they're to the point, if you're there and they have Ebola and you're intubating them, and it's not me being ugly, but say a prayer for them, because that's the reality of what it would be. The type mask that you would most likely need to use, or would probably have, would be this or this. This is all you need just for droplet precaution. And right now that's what it would be with, if someone has influenza, if they're sick and you know they have the flu, give them a mask. Put the mask on the patient so they're not spewing it all over the place, because influenza virus can live for several days on surfaces. This one has the face shield. I'm going to show you the full face shield, because I can wear this with my glasses, whereas this, I'm going to fog my glasses up pretty quick. I'm going to use just a regular mask, and I'm going to put this on first. And let me just do it as I say it. All jewelry has to come off. I know, just tear some of you guys up, but yeah, all jewelry has to come off, including the earrings. And I guess I'll just go ahead and take those off for a minute. Any jewelry that the female has on, any rings or anything, can cut through your gloves and increase your risk. You've got your mask, bind it down. This is a face shield that we're using. Anyone that goes into an Ebola, a room where a patient is under investigation, has a partner. No one is ever allowed to go in without a partner. And this is what the partner is going to wear. And the reason the partner is going to wear this is because if I have to step in and help my coworker, I need to be protected. I'm going to have on the full Tyvek suit. On top of the Tyvek suit, you have a plastic gown. This is part of what I like about these. You've got your thumb holes. Ties in the back. Some little bitty ladies at work like to bring them around and tie it in the front. And I've told them, for as cute as it makes their waist look, don't do it. Because anything in the front is considered dirty. And if you pop it, it's all of a sudden falling to the back and you can't see where it's touched. Again, the thumb holes, when you put your gloves on, is going to bring your glove well around where you have a nice barrier. Slap yourself in the face. Make sure you do it with clean gloves and not dirty.
Everybody does that.
All right. If we have a patient who has suspect Ebola, I'm going to have my full Tyvek suit on underneath. If I'm the person in the room, I'm going to wear a PAPR. The PAPR allows you to stay in the room for 2 to 3 hours. If you have the N95 mask on, as well as the face shield, it gets very hot very quickly. Underneath, I would have my paper scrubs, and we're doing paper scrubs so we can dispose of them, the Tyvek suit, and the plastic gown. We're very meticulous, and before anyone can go into a room or to anyone that is suspect Ebola, if Courtney is about to go, if I'm about to go into a room and Courtney is my partner, Courtney is going to say, stop. Let me check your personal protective equipment for any tears. And I'm going to do a 360-degree turn, and she's going to check and make sure that in this part of my body that I have no tears. She's going to make sure that I have my gloves on. With the Tyvek suit, you have an inner glove and an outer glove. The inner glove is taped. We use a special kind of tape called microfoam tape because it stretches and you can pull your personal protective equipment off without having to remove the tape. There is a little trick to removing the plastic gown. If you show up on the scene and someone is bleeding, whether they're throwing up or we're talking about Ebola or not, if you show up on the scene and someone is bleeding, you need to protect your face. This is what I would recommend for that. Protect your face, your body, and your hands. I think everyone, if you're first responder, you need to have these plastic gowns because it's impervious. When you remove the plastic gown, you're able to take all the body fluid that may have expelled onto you off. The way you're going to remove your personal protective equipment, the outer, you're going to leave everything on your head alone. As you remove your personal protective equipment, you're going to have, these are breakaway ties in the back, and it's a breakaway waistband. You're going to take your hands, put them at chest level. Everybody wants to reach up here. Your hands are dirty. If you reach up here, you've just contaminated yourself. You want to keep your hands as far away from your point of exposure as possible. So go at chest level, and you're going to grab with the pads of your thumbs, the pads. If you put your thumb in there, you're going to pop right through it, and you're just going to contaminate your shirt. With the pads, pull forward, snap that neck. Roll it. And if you pretend like you're riding a motorcycle where you're going vroom, vroom, this is the action, this is the direction. Thumbs to yourself and then point out to roll it out. Because what I've done is I've kept clean to clean. And as I pull this down, take my thumb, reach inside because the inside of my gown is still clean to the clean side of my skin. Tuck it into the middle of my hand where I can feel that I'm all the way in there, and pull and remove. Same with the other hand, pull and remove. That's my grab point to drop. Everybody wants to then bunch it up. You have no idea whether you just hit the inside or the outside. That's done. I can use alcohol gel to clean my hands. If I have had splatter, I would put on a fresh pair of gloves. Reach on the face shield. Bring it forward. No flicking or flipping. Then the mouthpiece, just remove, because this was underneath my shield. When you remove your gloves, outer to outer, inner to inner. I touch the outer part of my glove to pull it off. On this side, I take my finger inside and pull down. Now, all I have are large or medium gloves. Huh? Everybody's going to put on some gloves because I'm taking them off with me, because I will tell you that as we've been doing education, one of the hardest things that I see people do is remove their gloves wrong. And if gloves are your primary point of self-protection, I'm going to show you how to take them off to protect yourself.
How many gloves in the truck? Large gloves? Look, do we have?
All these mediums will stretch out fine. I don't know, they may not fit those hands. Dennis, you just stretch those suckers out.
I pop more than my share, nice size.
Huh?
I said, I pop more than my share, nice size.
But your gloves, you put them on like Pappy. Now, as a rule, everybody have their gloves. Anybody? Yeah. See, as long as you got them on somewhat, we're going to call it good. Okay, they make pretty good shirts. All right. How many people are left-handed? That's pretty good in a small group like this. I usually only see one person who's left-handed. That means everybody else is right-handed. We're a hand-dominant society. Reach with whatever hand you first choose and go to the pad of your thumb, pinch up, pull over and down, tucking your hand and pulling in as you go. Let me do that again. Here, pull out, tuck your fingers in, and you're gonna roll and let it roll off. The next one, take your finger to the inside of your glove, pull over, and almost like you're about to fling it like a rubber band. Everything inside that glove is contained. Now, if that's something you need to practice at, practice at it. I had a doctor, I swear to you, and I'm not kidding you, 3 hours worth of video on
No, that's how
personal
Tim
protective
does
equipment. Physicians are the world's worst about taking and putting it on and taking it off right. They're the world's worst about hand hygiene. He coughed in his bend of his elbow. Thank you. You can shake his hand. Did everybody get the flu shot? Okay. You need the flu shot. Huh? Yeah, that sucker hurts. That one hurts. Why hadn't you got your flu shot yet?
Are you talking to me?
No, he said he ain't got it. Go ahead and get the flu shot. Flu's already coming to Arkansas. What?
I never get one.
Huh?
They won't let me back in there.
No, they ain't gonna let you back in there, Marvin.
Y'all need the flu shot.
They won't let me back in there.
Huh? They won't let you back in there?
There's a pile of kids behind me and they go to silent.
You better go to Walgreens.
I ain't kidding, they let out.
More people are gonna die in the United States from influenza than anything else. You need to get your flu shot to protect yourself and to protect those who can't have it. If you roll up into someone's home and they've had cancer and you're going there because they're sick, I personally believe anytime you put on a title that says, I'm here to help you, that you assume a responsibility to do everything in your power to protect the patients that you're going to come in contact with. And I say this as one who has a lot of experience with oncology patients and a lot of experience with people, including pregnant women, and most especially the pregnant women who die from the flu. All right, so I just have to always get my spiel in about the flu shots.
You believe in Dr. Tishner?
I do. Dr. Tishner's.
Yes.
Yeah. Mhm.
I ain't been sick in 3 years.
There you go. Just don't come in contact with anybody with the flu.
Oh,
That's all I'm gonna tell you.
But now, and you don't drink. Yeah. This guy I worked with for 28 years, he's never had a sick day. And I asked, he said, every morning or most of the week, they take Dr. Tishner and just touch it to his tongue. And when you do that, it feels like it just goes through your whole. You know, it's that strong.
Yeah, he's catching more than buzz.
Yeah.
That's what he's doing.
But when I felt the cold coming on, I went down to Bob's and bought some. I took a swig of it, and I was trying to dig the oxygen out of my box. Right there in my breath.
I bet you were.
So I couldn't get my breath, and I was out of Bob Lowe to come out and see what was wrong with me. I was gasping for breath.
Only you,
You
Mark.
didn't even worry about no flu then.
But I talked to a lot of elderly people, and that's something they do believe in.
Yeah, some of the old remedies, and believe it or not, I'm an old nurse. Some of the old remedies work, but if you're exposed to influenza, nothing's going to work. You're going to get the flu. And if you've ever truly had the flu, you will never miss a flu shot. If anyone tells me I get sick after when I take the flu, I tell them they're just a big baby. No different when our little babies get their regular vaccinations. You're going to develop a certain amount of immunity. The immune response is going to cause muscle aches, low-grade fever. So literally, you're just a big baby. It's no different than when the babies get it. That's why we give them Tylenol before we take them to get their shots.
Hey, why did it move that for?
So that's my argument on that one. We force the kids to get it, and you've got adults who don't want flu shots.
No.
We have influenza A and influenza B, and the vaccine that's out this year is a quadrivalent, and it covers 4 different strains of influenza.
Yep.
So, to talk about Ebola again, the only time you're going to really have to worry about is if you have someone who has a positive travel history, and with that travel history, it has to be from one of those 3 countries of concern. And if they are from one of those 3 countries of concern, I promise you the Arkansas Department of Health already knows about them, because they can't travel into Arkansas without Arkansas Department of Health being notified.
No.
Is it unlikely then that they would be calling an ambulance and first responders would be called out?
It is very unlikely.
They'd be already calling you to come get them.
Yes, yes. The patient that we had that was under surveillance, it was already set in plan. MIMS had already been contacted that if this patient were to spike a temperature of 101 or greater, that MIMS would travel to pick up the patient in an ambulance that they would be able to take out of circulation. The distance to that patient, it would be a 4-hour drive to pick the patient up and 4 hours back. This just tells you how intense we are about the care of those patients. They're not going to go to a small town hospital if we already know about it, that we don't have the absolute confidence that they're capable and ready to take care of an Ebola patient.
That just reminded me of a question that crossed my mind earlier. That woman who was a healthcare
Hey,
worker
look at mine.
infected in Dallas, were
Yes.
they not using the right precautions, or how did that happen?
No, they were not.
Protective equipment?
No, they were not. Initially, they were not. And I will tell you that I kept tweeting Dr. Friedman with the CDC, and he never responded to my tweets, just so you know. And I kept tweeting and saying, your personal protective equipment doffing is wrong. They added finally a third doffing, or a third page to their personal protective equipment. They had 1 page dedicated to putting it on, a second one to taking it off. What they were telling you to do is before you take this plastic gown off,
What's in it?
you're to reach and take your gloves off. If you take glove number 1 off, before you take this soiled gown off,
Banana?
you've just put yourself at risk. And I kept, he didn't listen to me. I don't know if he ever looked at tweets, but yeah. But they finally added the 3rd page that had how to properly remove the personal protective equipment, doing the inner to inner removal so you don't have contact with your skin. Then they came out finally and said, okay, use PAPRs, do no skin exposure. Even before CDC had came out, I had to go to Channel 7 and stand there while they videoed me in full, the tie bag, the face shield, minus the PAPR, when that's what we were doing well before CDC had said you needed to. As infection control, my job has not only to do with the patient, but it's to protect the healthcare workers, and it's to protect it from going from here out into the community.
I just want to say I worked in a high school,
Uh-huh.
and if it ever hits that type of environment, we can spread that Wi-Fi. And I'm concerned that you only have 2 beds or something like that, because you're right, it needs to be stopped right there, because if it ever goes to a place like where
Right.
I work, the
Right.
kids are spitting and stuff all over the place.
Absolutely, absolutely. Let it get into a daycare. And that's where the Arkansas Department of Health And we have telemedicine that we're hosting from UAMS to rural hospitals that we can remote in and help with guidance with the patient. Not that we're necessarily taking the patients. We have not been deemed the hospital, although I think CDC is about to make their own statement. Obama calls him the czar, which cracks me up. Huh?
Yeah.
Right.
He don't know, come here from Sikkim, I don't know what in the world they got him living that for.
No, he's a lawyer, and so for him to come out.
Obama's an idiot too.
Right, but but he has this czar, who one of the things that he has now done is encourage the CDC, and by encourage I mean he's probably prompted it a little more, to reach out to all of the hospitals all over the country to find out who has what stockpile of personal protective equipment. And as soon as we got that first call, I told them, you watch. They're looking to see who is the most ready to handle this type of patient, and we're going to be deemed that hospital whether we want to be or not. And there's only so much that can happen. Montana has 10 beds for their Ebola, or for their biocontainment unit. They can only take 2 patients. Emory can only take 3 patients. It's so few because of the intensity of care, the number of nursing staff that are required to take care of the patient. You have in-room 2-hour shifts. And then you still have to consider that you're going to have to contain those employees. If I'm one of those taking care of that patient, I don't want to then go home because I like my husband. I really don't want to get him sick. And there are some family members that are saying, and we've had, and I will not kid you, we have volunteers who have stepped up for this advanced training. And in order for anyone to be in our biocontainment unit, we have this stuff called GlowGerm that we have. It's a 4-hour intensive training on donning and doffing personal protective equipment. You have to not only remove your personal protective equipment properly, but every person that has their personal protective equipment removed, you have a partner that's telling you step by step, literally, reach to your chest, grab your plastic gown, pull forward with the pads of your thumb, and it is literally that meticulous step by step, and they have a checklist that they have to check off. And as they check this off, we're going through one step at a time. And I know, because I'm your partner, that you are doing everything right. If at any point I see that you've violated your personal protective equipment, if I see that you've touched yourself, and I've given them heads up, if I see you touch your face by accident, I'm coming up and wiping your face with bleach. Just know that right up front. Because it's my job to protect my partner. Because in reverse roles, that partner is also the one who is turning around and who is coaching me on removing my personal protective equipment. So it's a really intensive training. In order for anyone to be checked off, we rub GlowGerm on the plastic gown and on their gloves and sleeves. They have to be able to remove their garb without contaminating themselves with this GlowGerm. And how would we know if they did that? We put a blue light on them. You put that fluorescent light on them, anywhere that GlowGerm has touched, it lights up. They are put right back through class if they contaminate themselves.
What is the percentage of people who have GlowGerm on them where they shouldn't, like other people who mess up?
As they've gone through our training?
After 4 hours of training? You
No.
get some that have GlowGerm?
No.
And that's good?
No. They're that diligent about it. They're all volunteers. They volunteered in for the emergency room, and they have, in our ED, we have a cart that's stocked and ready to move to the patient's room in decon. We have a cart that's ready to roll to ICU, and we have our training cart.
I think you already answered your question, but a lot of times on rescue we have, but, you know, brothers that tear, you know, and you just have to be taken off and you tear your glove,
Yep.
you know.
First thing you're gonna do is get some alcohol gel. Waterless hand sanitizer, that's your alcohol gel or your alcohol foam, is the most accessible to you in the field. It's gonna kill 99% of the stuff that you may come in contact with. It kills staph, it kills VRE, it kills the extended spectrum beta lactamase, which the ESBLs that y'all don't really care about, but it kills all of this stuff on contact. As long as you dry your hands and let it air dry. Don't wipe it off. You don't put it on there and then wipe it off and think you're good. You gotta put it on there and let it dry. Once it dries, then you're clean. It kills HIV, it kills, I mean, it's pretty good. And then of course you go use soap and water first chance you get. I also advise if you're in someone's home and you have to wash your hands, look for the pump soap, don't get a bar of soap. Bars of soap are nasty. If you're gonna get into something that you really suspect that you're gonna be getting into a pile of poo, if you've got a patient who's been incontinent on themselves and you're having to put them on the gurney, I started to say stretcher or whatever, gurney, it's okay to wear 2 pair of gloves. You know? Protect yourself more than not. Especially if you know that you've got some that pop holes in. The nitrile are better than the latex. Latex, you're constantly popping a hole in them. Vinyl, I've never cared for vinyl because it doesn't stretch and give enough. And it's easy to just really rip and tear, not even pop a hole in, but literally rip and tear. So the nitrile that we use, you can clean, have bleach on it, and it's not going to break down. If you get in a situation where someone doesn't have soap and water, you can go to the laundry room and get you a little bit of bleach and rub on your hands, on your gloves if you've got something on there that you're really concerned about before you take the gloves off.
You mentioned that you was gonna recommend, that we get the plastics.
I do, yes.
I mean, but you're gonna recommend, is that something we're gonna have to, you know, seek funding for, or?
Yeah, I don't know what you would do, but I really do. If you're not gonna have to wear this every time you go on a call. But if you go to a car wreck and you've got somebody pinned up in there and you see obvious blood, put on a gown. Do not expose yourself unnecessarily. You know, one of the other things that we're having to do is an ethics committee is being convened, not only at our facility, but at most facilities. Because if you have someone who has Ebola, and you've got one nurse in the room with that patient, and that patient is crashing, first thing the ICU nurses have said is, we have to go. We won't have time to go. You have to take the time. You don't have a choice. This is your life and the risk of spreading it to other people. It goes against every brain in any medical professional's being to think, I have to stop and put this on and I have to put it on right before I go in because this is so risky. If you have someone that is bleeding, I'm probably one of the world's worst. I'm going to walk up there and I'm going to stop the bleeding. But I have to say, you need to protect yourself. And if you're bleeding profusely, it takes really no time if you have this in your gear to grab this, put this on, even if you don't tie it around the back. If you get it over your head and your arms in before your gloves go on, pretty quick, and you're protected.
Something else everybody should have, it's not the same type of equipment, but if you come into a situation before you can get that and you need it, everybody should have an OB kit on the truck. There's your PPE right there if you have to have it.
That's a
There
good
should be
point.
a gown in that kit, there should be a face shield, and I'm not sure if it's one or two, but at least there's something.
That's a good point. But if you can have a box like this versus breaking into an OB kit, it's gonna be much cheaper.
Oh, yeah.
And it has a little pop slot where you can just reach in and grab it and go.
Where do you get that, like a box like that at?
You can order them through your, whoever you order your medical supplies
This
through.
one
I
came
mean,
through
they'll carry
Medline.
all that.
And there's a one size fits all that does not. Well, I'm serious. One size fits all does not fit all. And the back of it has the shield, back shield comes down about this far. As a rule, when I'm taking care of a patient, very rarely am I turned around like this where this is going to be my point of concern. This is my point of concern. It's kind of like you've seen people on the shows in surgery to where they're standing like this. This is your zone. This is your sterile zone. This is your exposure zone. Your arms up to here, here, and here.
Toward,
She's fine. And yeah, I'm one of those, you start breaking out an OB kit, I'm just warning you, I'm going to break. Oh my gosh. I have done every type of nursing in 30 years except for birth and babies. They put me in the NICU one, or in the nursery one time, scared the bejesus out of me. Haven't gone back since. Any questions for me?
Oh, I did have one other question. I've noticed a really sharp drop off in the reporting of Ebola by the media. Did somebody slap their hand and say, you make people crazy, you gotta stop reporting on it?
No, we just haven't had any new cases come through. And what you're getting is there's HIPAA.
Oh, okay.
A patient can tell you, do not release my name. Arkansas Department of Health will not release someone's name if they're just a person under investigation and if they're home doing self-monitoring. The reason that they're not is, like I said, the children are, they don't want them, don't bring the kid. Kid can't come to school. Kid hadn't been around I mean, people just kind of get a little freakish. Really? Yeah. Now that nurse riding that bike through town, she did that as kind of a thumb.
Yeah, she was snubbing.
She was snubbing, and I disagreed with that because it was a political action. Her freedom is her freedom, but I disagree that she did that so publicly. But that's just me, and I'm opinionated. But right now, everybody, the way they've got it set up to monitor anyone who comes from, because there's only one place. I mean, they have to go through Nigeria to fly out, even coming through Kenya. So there are very few places they can fly out of. And when they fly out of West Africa, it's an automatic alert, no matter where they're going in the United States or anywhere, any other country. It's an alert that the CDC and the World Health Organization and all the other different entities out there are just really watching, because this is one of the worst things that, I mean, I'm just blown away at how many deaths and how devastated they are over there.
What would you reckon the probability be, and I'm thinking of how it might get here, but say somebody comes into a different country and comes across either Canada or Mexico, the border there, is everybody else pretty much taking the same due diligence, or?
All the other countries are, yes. Anyone who leaves Africa, their travel is surveilled. It's monitored from Africa, whether they go to Paris, whether they go to London, whether they go to Montreal, wherever they go. World Health Organization is monitoring it all.
Okay. That's what I was wondering, is if it had been left up to some of the other countries, because everybody knows
With
all
this,
is not equal.
with this, you've probably got your largest world union together on this is what we have to do to stop this, because this, if this were to get into China,
Good boy.
it's not that their healthcare couldn't take care of it, it's their population is so dense that it would have the potential to be devastating. And there are many places like that, and everyone wants it in their country. No one wants it in their hospital. It is Presbyterian Hospital in Texas. I don't know that how many years it'll take before they're able to recover financially, because they had no one coming through the ER, only emergent admissions that didn't have a choice but to stop there. All of the elective procedures were canceled. People didn't want to go there because they were afraid they would become contaminated.
I can't blame them though, because look how bad they dropped the ball the first time.
Well, and see, it really wasn't the hospital that dropped the ball. When he came in through the ER, that first time, he did not state where he had been.
Well, he didn't want to say it because he had a warrant out for his arrest, because when he left, he went and visited his family in Nigeria. And he lied about where he'd been when he left Nigeria. You know, that's how come he didn't want to tell him where he'd been.
Right. So there are all sorts of underlying right there with that as soon as they knew what they were dealing with, as soon as they knew his positive travel history when he came in, he was immediately quarantined. The nurses being exposed were because they followed CDC recommendations, which were inappropriate at the time.
See, that's what I hadn't heard, because what, as far as I know, the media had said was that he had told them the first time, and they didn't think he had it. They just sent him home as a Florida.
No. Even when he was in the hospital, the nurse asked him, you know, she was standing there and she was talking to him, and this was on 60 Minutes actually. He admitted to her that his daughter had died during childbirth in Liberia, and that he was there for her burial, and that they buried his daughter and the baby. And when she was questioned by the CDC, she gave that report, let me back up, she gave it to their Department of Health. The Department of Health and the CDC came in and he denied, even when he was positive for Ebola, he denied having told her that his daughter had died in childbirth and that he had been there at the burial. So that was even while he had known Ebola, he was still denying it. But he was being treated, but at that point, he had had such volume depletion, and what happens when you lose all of your electrolytes, your potassium and your calcium are
Nothing
what?
works right.
That's exactly right. Your calcium drops, that helps regulate the contractility of your heart. And your kidneys start to shut down, and when you go into multi-system failure with Ebola, there's not anything that's going to reverse it, and that's why people die.
Strap the parachute on and do a little grab, pushing out the door.
But that's also why it's really such important to get good medical care early, is to make sure to keep that volume up.
Well, and that's why the missionary worker, Nancy, I almost had her name, and Dr. Brentley, because they were self-monitoring. And as soon as their temperature spiked, they were tested for Ebola, and they were positive, and they started the fluids and the hydration before they even went to Emory. Had they not caught it early, they would have had the same result as the other people in Africa. It's all about catching it early and getting the fluids and replacements, because it's going to come out. It's going to happen with this virus. And like I said, the virus itself is fragile. It's easily killed on surfaces. So it's not like someone else going into the room after it's had a terminal clean is at risk for picking it up in the room. You know, we have things, like I said, VRE lives on surfaces for 30 days. You know, you've had someone who's had MRSA or staph infection. That lives on surfaces for up to a week. Walmart and Kroger are going to sue me because I use them as examples all the time. You have people out, the more we're driven to outpatient managed care, someone who is positive for some of these pathogens are out in the community, they're walking around in the ambulatory care settings, they're going to the doctor's office, they're going to Walmart, they're going to Kroger. It's the way it is these days.
Guy I work with got something like that on his ankle.
Huh?
Guy I work with has something like that on his ankle. I swear it's that. I don't think he's been to the doctor yet.
You know,
You just gotta protect yourself.
and
But I keep telling you, you need to go get that seed.
well, you
Whatever.
have to get it taken care of and treated. I would have sworn that I would have been colonized in all my years of nursing, that I would have, because once you have certain organisms, they live with you the rest of your life for the most part, and they're just opportunistic organisms that may sneak up on you if you have a break in your skin or something. But so I'm being told that I'm past my time, and I look up and it's 8:12. Sorry, I can just keep on talking.
Out of curiosity, how effective are the antiemetics and diarrheas and things that we have? I mean, you keep talking about hydro. Do they try and slack it off, or do you just let the virus go and keep the fluids up?
There's nothing you can do. Imodium, Lamodal, nothing's going to slow it down. It's got to run its course, and what's happening is that it's so vicious that it's causing some bleeding.
So the big take-home messages are, is go on your personal protective equipment in situations, not just, in any situation. Protect yourself first, right?
Yep, nothing worth taking home to the family. Protect yourself and perform hand hygiene. Keep your hands clean. And this for just about anything. Anything else? All right, I'm going to leave those discs. On both of those discs, there are PowerPoints on how to take off personal protective equipment with the full Tyvek and the mask and everything, as well as PowerPoint with the PAPRs. Like I said, that's the purified air apparatus thing. All right. Thank you.
Thank you so much.
Thank you.
Come on, go home with me.
Hey, we should somebody to see it.
Right.
this type of use.